Hello everyone, welcome to Side Mirror SSD. My name is Atim Sijan, your only platform where you will get to be informed on the most trending social issues in the country and across. Today I would like to talk about a topic that is a little bit sensitive and people don't like talking about this, but I think it's high time for us to start educating ourselves about the most issues affecting our lives as part of the society we live in. And this being said, I would like to mention some few highlights on this topic. And the topic is about HIV/AIDS in South Sudan and most weird thing we do to prevent ourselves from, doing the right thing. And culturally and with our norms and practices, it's very hard to talk about such topics. But we don't have to ignore the fact that it has become a serious crisis, and people across the country are suffering a lot from this disease. And it's high time for us to start conversations on such kind of topic. To start with, we have realized that HIV/AIDS is killing even at the cattle camps, and I want us to explain how the virus left from the towns to the cattle camps to the villages where people have less access or less exposure to the life that might have or is always linked to the HIV/AIDS circulation in any country. I think in other countries, of course, you find that in urban areas is where that this HIV/AIDS is concentrated, because there are brothels, there are hotels, and so forth. There are disco clubs, and all those things that might trigger, the increase of the infection among the youth and even the elderly people. But in South Sudan, it has been the case, and it has not been the case at the same time. You find that the virus has moved so fast, and it is coming back now from the villages, from the villagers who do not have access to discos, now to town. So there is no difference between the rural and urban town in terms of infection currently. And we want to talk about why exactly this is the case and what might have contributed to this kind of situation we are in. To start with, most of our people in the villages, they come and sell their cattle in town. Like, I knew of people who have been traveling all the way from the villages to places like Koboko to cross the border and sell their cattle, get the money and come back to the villages. And these people are not informed whatsoever. They know less about HIV/AIDS, and some of them would go sell their cows and then spend some nights or some days before they travel back to South Sudan. And when they spend some days there, they will find these girls, fine girls, and beautiful girls across the border, whom they will have pleasure with and come back to the village. And of course, with lack of knowledge on protection, you find that 95% of these people are not willing to use condom. And even they would even pay much money to have sex without condom. And that has contributed to the high rate of HIV/AIDS from the villages, from the cattle camps, and such areas of the same setting. So now the situation is, most of these people, they come back to the villages, and you find that they have 2 to 3 wives back home. So you went, sell your cow, spend a week or two, get infected, come back home, and mess up with your 3 wives. So after having sex with all the 3 wives, of course, you infect them with the virus that you transported all the way from the border or from the place where you sold your cows. And then when this person passed away, of course, there's no medication, there's no access to health facilities, and even there's no way. In most of our villages, you find that women and men do not go for checkups. Even during pregnancy, there are no maternal care services that they get at the cattle camps. Most of them will get pregnant until they deliver without any medication or any checkup, whatever the case. So this becomes a challenge. So you find that a mother will get infected from the husband who is trading or selling cows across the border, and then she will deliver the child, and the child will breastfeed, and then the virus continues. So not until someone becomes very sick, in most cases of which they will pass away, and then people will just bury the person and call it any sickness. And then the same person who passed away and had 3 wives, the brother will inherit the wives. And the brother maybe had his own wives. So you find that the brother to the deceased is given the 3 wives to inherit, and he has like 2 or 3. So of course he will get the infection again from the wives of the deceased. and then send it back to his wives. And the virus continues. So it is of late that people have realized that when someone is very sick, they bring him to town for medication, and when tested positive is when now the whole family they become so vulnerable, and such things are happening. So what do we do as exposed people who are part of these communities? How do we support to make sure at least this infection rate that has really hit deeply in the villages can be managed? And it is going to be hard for South Sudanese, especially for people from my tribe, who would not want to talk openly about sex, about protection, and about HIV/AIDS. And not only in the villages, even in town, you find that someone who is exposed, who have gone to school, who is learned, will not be able to accept the use of condom, whatsoever the case. And you will see that some women, some girls who have gone to school, who are at high school or even at university, the first, second, third year university, they still have the assumption that using condom is only for prostitutes. And if someone who has gone to high school still believes that using condom is for prostitutes, what do you expect from somebody who did not even attempt to go to school? So the ignorance is not only at the level of the villages, but the ignorance has spread across different status of our communities. And even in Juba here, the capital city of South Sudan, you find that even those who are well educated do not buy the idea of using condom at some point. And the same assumption applies where we look at it as only used for prostitutes. And this is a very worrying situation, because I have seen a lot of health organizations who are distributing condoms. But is it about distributing condoms, or is it about creating awareness first? You have to create demand for the service. I have seen so many condoms getting rotten in the boxes across Juba because no one is using them, but these agencies will keep putting condoms to those places, and of which no one uses them. I like one of the campaigns that was done by one of our youth, very energetic youth by name Data Gordon, the Condomize campaign, where he talks vocally about using condom. And this campaign has been going on for so many years now. I think 2 years now, if I'm not wrong, or more than that. And the Condomize campaign is taken as a joke. People think that it's just about creating memes on Facebook, but this is a serious campaign that needs to be picked up, and it has to be taken to the grassroots, to the villages, for those in the villages to benefit from it, for the use of condom to be taken into consideration, to create demand for the usage. Instead of putting them there with less awareness, it's better we create awareness. We invest so much in awareness, and when people are now turning up and they have known the importance of using condom, we are able now to distribute condoms. Otherwise, we are putting resources in something that is not going to yield results very soon. So people need to know why condom is important. People need to know about HIV/AIDS. They want to know about protection, and they want to know exactly why using these condoms will help them to avoid or to prevent themselves from getting the infection. So I will talk about that because I think it is a concern, and I would call out Data Gordon, one of my good friends, to at least take this campaign to the grassroots. I know it's not easy, and most of our agencies that support such initiatives, they have their own plans. Sometimes they don't listen to the local inputs on what can be done. So, and we believe that communities are part of the decision making, and most of us nationals, we are always there to give the perspective of our communities. And sometimes these agencies will have their own mindset, will have their own objectives, and they will do what they think is right, not what the community wants. So, and it's good for us to reach out to these agencies and say that this is high time for us to have a very massive campaign on HIV/AIDS and the means of protection. At least this campaign will be supported by the government and all the agencies, because if we don't do that, we have another serious crisis, another serious health crisis that is going to hit this country. Apart from HIV/AIDS, we have also what we call hepatitis A, B, and E, which is also very common in South Sudan. So, as we are fighting the pandemic, which is COVID-19, let's not ignore the fact that these crises are also eating up our society, our population, slowly. And we just sit back and do nothing about it. It will reach a point that we will not do much, and it will be a serious crisis, a humanitarian crisis in the country, and it will affect the human resource of this country, and it will also affect the production in this country. So my point of view is that let's start talking about HIV/AIDS. Let's start talking about methods to prevent ourselves from getting infected. And let's also scale up activities like the Condomize campaign and take it deeply to the grassroots where people can benefit from it and they can also make sure they learn from it. And we also believe communication behavior change is not a one-night thing. It's a process that can take so many months or years to make sure at least people get to know what we're talking about. And saying that, we don't need to stop. Of course, we need to start and we need to keep going, because changing people's narrative, people's mindset is a process. And just to say that, I think it's high time for us to join hands as youth and do some serious campaigns, because otherwise our communities are being eaten up. I will tell you also another scenario where you find that most of the youth, even those who have the intention to use the condom, if you go to a pharmacy, you will see that a youth will enter a pharmacy and would not want to mention that they want condom. There are two things that we fear to mention, and that is because of our high level of hypocrisy that our community has, and we are very judgmental. We are a very judgmental community. We like judging ourselves a lot. And being a judgmental community, sometimes people fear to express themselves on what they want. I once went to a pharmacy to buy some medicine, and a very young, energetic youth came in, but of course there were a lot of people in the pharmacy, so he stood there. Not until he caught the attention of the pharmacist and he was asked, "Young man, what do you want?" He said, no, you finish with them first, I'll tell you later on. So when people come and go, he was still standing there. Of course, you want the pharmacy to be so empty, only him and the pharmacist, for him to be able to ask that he wants condom. So it happened, and me, I picked interest in that, so I also stayed behind. So not until only three of us were left, myself, him, and the pharmacist. And they asked him again, "Young man, you've been standing for a while. How can I help you?" And he said, no, I'll tell you, just wait a little bit. Then I'm like, "Do you need condom?" He started laughing at me. I'm like, "Yeah, I know. Because the only thing that we fear to mention is condom. But don't you think it is good for you to just say, I need condom, even, because you're trying to protect yourself. So why do you have to be ashamed of asking it at the pharmacy? And they're just there. They're displayed in the pharmacy. And people know that people buy condoms, so there's no need to feel offended or to feel scared of asking." And he was like, "Yeah, but our community, they're very judgmental. They will look at me badly." So we are fearing to be stereotyped. But also, there should be campaigns on condom. I was in Kenya and Uganda. There's ABC campaigns like abstain, be faithful, or use condoms. And this has been going on in all the public schools. People have been talking about it openly at churches and all other places. But if we avoid talking about such important issues, then the more this virus will dominate our communities, and it will affect us in different ways. So we need to talk about it, we need to shout about it, and we need to make sure at least we take action. It is now or not happening forever, because you find that the new infection rate in South Sudan is very high. It keeps going up, and there are states that were leading before, and some have overtaken the others, and it is going on and on and on and on. And it means this is a very serious crisis. It's a health crisis, and it's upon us as youth, it's upon us as leaders of this country, it's upon us as people that are well informed to make sure we launch these campaigns and make a great impact in our communities. And also, let's go to the villages, because this thing is affecting a lot of villages currently. I saw a report about Rumbek. Some youth went to Rumbek to do awareness on HIV/AIDS alongside COVID-19. And I would urge also people from Bor or anyone who is interested to go down on the ground, do the same thing. I was happy when our Minister of Health in Bor launched a campaign on massive circumcision. It was taken as a joke on Facebook. People are making memes out of it. But this is one way of preventing, or one way of trying to minimize the risk of infection. But nevertheless, use of condom is one of the ways that we need to promote, or if not, we need to abstain. And some of these things need to be taken seriously, or otherwise HIV/AIDS is going to be a serious crisis in the country, and it's going to affect a lot of people. Last but not least, I would like to mention that we have prostitution that is happening across the country, and also we have high level of alcohol consumption that's also contributing. All these are things we live with, and this is how urban center is. But also, having conversations on such things will help to give knowledge to people. And we always say that informed communities are less vulnerable during crisis. People who have information will make informed decisions. Like if you have information on how to prevent yourself from getting infected, of course you will want to use condom, or you want to abstain, or you have to be faithful if you are married. So these are ways you can at least avoid or prevent yourself from being infected. And if this information is put into somebody, or if someone is well informed in such a manner, they will take all the necessary decisions to protect themselves. So thank you so much, and let's hit the conversation. Let's keep it going. Let's go down to the grassroots, and I'm calling out Data Gordon. Condomize was a very big campaign that has really caught the attention of the community, but let's take it deeper to the grassroots. And trust me, this country needs a lot of awareness on HIV/AIDS, hepatitis B, tuberculosis, and also the COVID-19 situation. These are things that we're going to live with, and we just need to make sure at least our people are well prepared to get the right information and prevent themselves from getting infected. Thank you so much. My name is Timsigen. If you haven't subscribed to our channel, please hit the subscribe button and support us. This is your only platform where we talk about the most trending issues in the country socially. And we know also, if you have any comment or anything you want to add, please do reach us out on this platform, and we'll get to communicate and move things forward. Thank you so much for listening.